Good evening. Good evening. Welcome. Happy New Year to our friends, our families. Thank you so much for joining us for our monthly webinar series. I am your moderator, Brother Kelvin and Pofo. I'm the 37th Second District Representative of the greatest fraternity on this side of glory, the Omega Psi Phi Fraternity Incorporated. Certainly on behalf of our Grand Bossless, Dr. David E. Marion, and our first Vice Grand Bossless, Brother Ricky Lewis, we certainly hope you and your families are doing well. We certainly want to start off by simply acknowledging the unfortunate passing of the national president of Delta Sigma Theta Sorority Incorporated, uh, President Cheryl A. Hickman, unfortunately transitioned just a few days ago. And I know that our sisters of Delta Sigma Theta, we are still mourning with you. And we just wanted to play this quick video in remembrance of her.
One word: disbelief, shock, surreal.
For Dr. Lakeisha Grant Washington, it's been a wave of emotions following the death of Delta Sigma Theta's national president, Cheryl Hickman.
It is very personal. She is a member of the Harvard Alumni Chapter, and we're just mourning.
While Hickman's sisters in red grieve, they're also reflecting and celebrating her life and nearly 40-year legacy with Delta Sigma Theta. You see, Hickman was a Hartford native and held several roles with the organization and served with Delta on a national, regional, and local level.
She made many friendships and partnerships with state legislators and made sure that when there were issues that needed to be spoken about that represented the Black community, that she was that voice or helped us to be the voice, especially in the greater Hartford communities.
Dr. Grant Washington says Hickman truly illustrated the sorority's principles of sisterhood, scholarship, and service.
She always did that from a point of doing what was best for the community and making sure that we always operated in the best interest of Black and brown people of the greater Hartford community.
Although Hickman is no longer with us, her sorors say her work in the community will live on.
I think we would do her the most justice of continuing her legacy by always making sure that we are serving the community as she would have had us do it.
In Hartford, Raquel Harrington, Fox 61 News.
And so certainly once again to our sisters of Delta Sigma Theta Sorority Incorporated, your brothers of Omega, we are still with you over that sudden and unfortunate loss. So for tonight, we have our agenda. We have our work to do to continue to ensure that we educate the public, our community, as it relates to this pandemic. And so certainly I'd ask that you, as always, please be mindful that the comments and views expressed by individuals tonight are their own. They do not necessarily represent the views of the Omega Psi Phi Fraternity Incorporated or any affiliation that the speakers may be affiliated with. So with that being said, as always, we start off with 1978, our spearhead, Dr. Boykin, who always gives us the facts. Dr. Boykin, it's so good to see you. And we are ready for your updates, Dr. Boykin.
Well, good evening, and I want to take this opportunity to welcome everyone to our monthly webinar. And to my sisters of Delta Sigma Theta Sorority Incorporated, I agree with you and offer my sincere condolences. As with any time we talk about this current situation in our country, we have to mention some of the statistics. But, you know, statistics suggest that they're just the numbers that we see what's going on in our community. So we know that the big name out there right now is Omicron. And Omicron is probably the majority of the cases, 99.9% of the cases, and recently discovered a new subvariant, BA.2. But I want to caution people that I think that we should not be so pessimistic about Omicron because Omicron, thank God, is not as infectious as Delta was, but is highly transmissible. And to that end, we have a lot of our elderly people being at risk. and a lot of our children being at risk just because of the sheer number of cases. And the sheer number of cases is what's overwhelming the system right now. I mean, hospitalizations are up, not because of the infections, it's because of the amount of volume of people getting sick. And people getting so sick they can't get in to see their primary care, so they end up in our emergency room. And that's taking a toll on our system, which we should hear about later on tonight. But I want to give you an interesting statistic I found about the children. When you talk about COVID cases in children, a third of the children that are hospitalized were not hospitalized for COVID, but rather hospitalized for something else and found out to have COVID. And then the other 2/3 of those kids that were hospitalized due to COVID. So we have a high number of cases, but the good news is it appears to be that the infectivity, the transmission of COVID, of Omicron is slightly decreasing. So we're looking at a downward trend, but we're not there yet. So I don't want people to take a cavalier attitude and say we don't have to worry about it anymore. We still need to do it. You need to do what's best for you. And again, we're here to offer information, and I hope that everyone can make an informed decision about what we talk about tonight. And to that end, we talk about vaccinations all the time on these webinars. And as I said earlier, I'm not here to offer my judgment on you at whether or not you're vaccinated, because vaccination is a choice. And it's a choice you should make with informed decision based on evidence and your own research or your discussion with someone about it. If you don't do that, the next thing we have to think about is how we can prevent the transmission. And of course, we know now that masks are the way to go. And I know there's a lot of controversy out there about masks, but I won't get into that. But just suffice it to say, that's the way to protect those that cannot be vaccinated for whatever reason or choose not to be infected. I know a lot of people choose to be infected, but I hope they won't do that. So masking is the way to go. And we know now that the government is passing out N95 masks that's going to be available at grocery stores and supermarkets, as well as we have home testing now that we have access to. I know they're in low supply right now, but hang in there, be tight, because we're going to get those things done for you. And the last thing I want to talk about is our community of color, and specifically the African American community, because the vaccination rate in our community is really, really low. I mean, we only got like 10.1% of our population, the African American population, that have been vaccinated, and 9.9% fully vaccinated. And boostering and so forth is coming on. You hear a lot of things about vaccines coming out. Yeah. But the main thing to do is you need to do what's best for you, and you need to do what's best to protect your family. So, we got the statistics of, we low vaccination in our community. And I hope that at some point in time, if you're worried about vaccination and have some doubts about the vaccination, that you would sit down and talk to someone about it, so we can at least help you make a decision about it. Don't let the statistics worry you, but please think about the best way you can protect you and your family, because you're the one that's going to protect yourself against getting COVID-19, while others are going to protect themselves. So with that, Brother DR, I will yield back my time.
As always, Dr. Boykin, it's such a pleasure. Thank you so much for that statistical information. It's so imperative. It's so critical. We're going to move to 88. All of you that have joined us, that have been with us for almost 2 years now, dealing with this thing, Dr. Jedan Phillips, he's been with us from the beginning, right at the epicenter from New York. Dr. Phillips, take us away, my good brother.
Well, good evening, everyone. And again, my deepest condolences to the ladies of Delta Sigma Theta on the loss of their national president, a great, tremendous tragedy. Again, I am a family practitioner working here in New York. As Dr. Boykin alluded, we have seen the cases seem to have plateaued and starting to decrease. We're also seeing some improvement in the hospitalizations. However, still seeing the same trend of individuals that are being hospitalized, or even more serious conditions such as requiring ICU, still are majority unvaccinated and individuals that have significant chronic medical conditions. In addition to that, the other thing that we're starting to see, and it's becoming more and more of an issue, is the staffing issues associated with the stretch of the medical system. I have seen it in the shape of patients having elective surgeries such as a hip replacement, and that needing to be rescheduled, unfortunately, because of issues related to the pandemic and people not being able to work. So we're also seeing an interruption of our chronic medical conditions. I had a patient recently come in who is a hypertensive patient, had not been able to get into the office, and the patient ran out of medication, came in, blood pressure was elevated, and fortunately did not have to have a situation such as a stroke, which could happen very easily. But again, just one example of the bigger problem of people not being aware of staying on top of their chronic medical conditions, whether it's getting their medications, whether it's staying on top of their diabetes, and again, not being aware. And I blame that awareness in part on the medical system. Again, the distrust in the space and distance that we have to own up to it. We have created this area of distrust. But again, we have to continue to be diligent in trying to rekindle that bond, because again, communities of color, as Dr. Boykin just mentioned, are suffering. And as I was saying, recognizing that there are other modalities that you can see your doctor. You can do telehealth. One of the things that we're doing, try to help other aspects of the medical system, is taking more telehealth appointments. What does that mean? Every time someone calls the office and they're not able to be seen, in most cases, if they have any type of symptom, they're being directed to the emergency room, which is putting an amazing burden on our emergency room system. So one of the things that we're doing is I volunteer at times to do telehealth appointments, which is I manage a patient that is may not majorly symptomatic, but mildly symptomatic, so that I could deal with some of their issues so we can offset some of the burden that we're starting to see, because the issue of burnout is real. You're seeing interactions, explosions that occur at very basic moments. You checking into the doctor's office, something doesn't sound right now, everybody's talking, So again, that is something we got to be mindful of, because you want the best healthcare provider. And I know the healthcare providers want to be that, but everybody's tired, and we've got to be mindful of that. In addition to that, we've all got to have a plan. Whether you're vaccinated or not, you have got to have a plan of how you and your family operate. That includes being mindful about vaccination and whether or not you want to get it, and the reason why. But it's also related to masking appropriately, because still a lot of the people that I see coming in the office now are getting it, and they may be mild cases, but they are getting it where they had lapses in their safety measures. In addition to that, as I said, we've got to make sure that if we had health issues before, if we have been overweight or underactive, we got to start changing that, because again, if Omicron, which is very infectious or contagious, it could get anybody. And we are still seeing that in the vaccinated area, those with high risk chronic conditions that are not well controlled tend to have more significant circumstances. So with that, I think I look forward to tonight's conversation. I think, again, it's very important for us to get up here and talk about this stuff. Thank you.
Thank you so much, Dr. Phillips. And certainly we have a special treat for everybody. We have a very, very, very special guest for everybody, especially our sisters of Delta Sigma Theta. So stick with us. We're going to go to 1990. Brother Wonzie Gardner. Again, this brother always gives us information as it relates to the federal government. Brother Wonzie, it's always good to see you. You have the floor, my good brother.
Brother DR, thank you. And I too like to send my heartfelt condolences to the ladies of Delta Sigma Theta on the loss of your national president. I'm going to keep my comments very brief and short tonight because I'm looking forward to our speakers well. Just want to give you an update of what's happening right now with the federal government. As you all may be aware of, on last Friday, a judge in the state of Texas issued an injunction on the Biden administration and their rollout of the vaccine mandate for federal employees. The good news is this: over 98% of all federal employees have been either vaccinated or in compliance with what we call a reasonable combination for either a physical or medical reason. There's over 93% of all federal employees have had at least one shot to fight this vaccine. So right now, the federal government has a stay is what we can do as far as vaccine enforcement, vaccine employment, and using the vaccine as a condition of employment. So we're standing by right now to see how this is going to play out. But I'd like to take this time that we're still monitoring things closely. Omicron is on the rise, as we'll talk about more, and we need to be vigilant in our own personal ways. That's how we try to fight this insidious disease and virus affecting us right now. With that, brother Dr., I'll turn the rest of the time back to you. Thank you very much.
Thank you so much, Brother Wonzie. The fourth horseman, last certainly not least, 91, that mighty Kai, Dr. Guyton, the pharmacist that brings us the information straight from his office. Dr. Guyton, good evening, team.
Hey, it's a pleasure to be here tonight to really speak to you all. Again, I want to give my heartfelt condolences to the ladies of Delta Sigma Theta on the loss of your national president. We are all looking at over 20 something months of this pandemic, and we still are still in the fog. Now, we do have a lot more tools in our toolbox to protect our safety and prolong life when we're infected. But I want to remind you, do not get and let the fatigue lessen your ability to protect you and your family. Omicron is real. We see that it is impacting hospital systems and impacting our communities far worse in the southern states and the Midwest, where we're still seeing a lot of our federal partners being deployed to work with these hospitals. The fatigue is real. In our hospitals, our nurses, our doctors, our respiratory therapists are all feeling this pain. So when you and your family start planning your future, now you got to think about, where would I get care? Am I able to go to my local hospital now just to get routine chronic care? Think about that. You have an appendectomy that is needed, appendicitis. You may not even get into that hospital now because of COVID, because of Omicron. Let's talk about some of the paradigms that are shifting now with treatment. We all know the best way to prevent hospitalization and death is utilizing the three platforms we have for vaccinations. As of December, we've added another platform that can assist in, treatment of COVID. We now have an oral medication. The oral medication, Paxlovid, was authorized by the FDA on December 22nd. In some states, Paxlovid is now being distributed for free. Virginia is one of the states. You can go to the local state websites now to find treatments of COVID. There are websites in each one of your states that tell you what treatments of COVID. Listing the treatments would be monoclonal antibodies, the vaccine, as well as now we have another tool in our toolbox, oral medication. The oral medication itself is recommended for within the first 3 to 5 days of infection. You will have up to 88 to 89% of treatment positive outcomes. Now, let's talk about monoclonal antibodies. As we've gone through a number of variants, we've seen how monoclonal antibodies is taking the front seat to those who don't want to get vaccinated. Well, as of January 21st, 2022, the FDA has pulled back its EUA for monoclonal antibodies to treat Omicron. Yes, we have got to the stage now where Omicron, whether it's less virulent but more contagious, but at this point, they're finding that Omicron can't not be treated adequately with monoclonal antibodies. Yes, we have a tool provided. Now we have one pulled back. What we still need to do is understand those mitigation strategies, mask, making sure that you get tested, making sure that you are washing your hands and not gathering in large crowds without a mask. As we continue to look at the impact to our communities, the impact to our hospitals, which are overrun and need decompression, we must stay vigilant and understand that this is not over. We are also now running into a high number of mental health issues. Behavioral modification is real. Our behaviors have all been modified by this pandemic. So I'll leave it there, Brother Ampofo Dr. And so we can meet our esteemed guest.
Outstanding. As always, Dr. Guyton, it's always a pleasure. To the four horsemen, as always, I tell you guys, thank you so much for all that you do. You continue to uplift the community, and I thank you all for your support. At this time, ladies and gentlemen, brothers, friends, family, and guests, it is my pleasure, it is my honor to introduce to you Dr. Melba Taylor. Not only is Dr. Taylor a wonderful lady of Delta Sigma Theta sorority Incorporated. She is an emergency physician, disaster manager, community activist, and health educator. She blends these interests in her pursuit and promotion of community based disaster management as a means to developing community resilience and fortitude. Dr. Taylor has served as a physician, advocate, and educator in large urban academic medical centers in New York City and Ghana, and rural community hospitals in New York, Pennsylvania, Illinois, Maine, and Georgia. I could go on, but we want to hear from our friend, our esteemed Dr. Melba Taylor and Lady of Delta Sigma Theta Sorority Incorporated. Dr. Taylor, good evening to you, and thank you so much for joining us tonight.
Good evening. Thank you so much for that introduction. I appreciate that. And definitely to all the sorrows out there who are mourning our passing of our national president, send light and love and, standing beside you side by side, back to back. We got this,
Dr. Taylor, please talk to us about what you're seeing in the emergency rooms. Talk to us, tell us what's happening for those of us that just simply aren't aware from an emergency room perspective.
Well, what's happening is that our safety net is being stretched, I think that people are not really aware of it. And so when they come to the emergency departments, they have expectations and memory of the last time that they came when it wasn't so stretched. And so they are really frustrated. And so it's a lot of, a lot of the similar stuff that you see about the airlines and how they're fighting with flight attendants is actually happening in the hospitals in the emergency department. But because of HIPAA and other reasons, it's not like it's not getting out there in the same way. Do you know what I mean? And it is really impacting the just the resources that are available to be able to provide care. And so even if you know what to do, if you ain't got what you need to do it can't be done. And so it's affecting just all of it, man. It just really feels like it feels kind of like our safety net has become a trampoline, like people just bouncing off of it, you know what I mean? And so I really, yeah, I don't even know what to say, you know what I mean? I'm frustrated, and so you have to forgive me about that, you know what I mean? But it's just, I have to speak on behalf of all of emergency medical personnel from all pre-hospital care where everybody is strained to the limit, and that there's a lot of focus on what are the hospitalizations and what are the deaths, but the suffering there's no metric for the suffering that people are experiencing, and there's no there's no numbers really that are put out in the main media about how the safety net is, like we're diverting ambulances, you know what I'm saying? So not only are people not able to see their emergency doctor or their primary doctor, so their diabetes and that stuff is not under control. When they do get to the emergency department, they're extremely sick, and in the waiting room, there's a bunch of folks who are really not that sick, but who think they have COVID and now coming to like, what should I do? And it's sort of like the same thing you would have done for any other cold. Go get tested and try to stay home and don't come here unless you absolutely need to. But then understanding that you realize that people don't understand when they need to, and so really I feel like we're trying to have a conversation with bumper stickers that really needs to be had in conversation to be able to allow people to understand how to navigate the system and where the bottlenecks are and what we can do to try to really expand access so that it's not just all through the emergency departments, especially as the clinics and the other places close for all the various reasons that they're closing.
That's something that I think people, just wouldn't think about, between Dr. Taylor, between Dr. Phillips, I think people think that, obviously if there's something wrong, they just go to the emergency room, but these are the things we need to be aware of that's happening as people need emergency medical attention. What would you say to people that are either questioning or wondering, pondering if they should go to the emergency room? Can you talk to us a little bit, since we're in COVID? I mean, the difference between, yes, definitely go to the emergency room versus maybe there's some other alternatives?
Well, I think first we need to acknowledge that the way that our system, our healthcare system in America is set up is that the emergency department is universal healthcare. Like that is our universal access, no matter what, anybody, anytime, anywhere, you can go to the emergency department. Even it's like a Republican talking point, like, oh, we already have universal healthcare, you know what I'm saying? So people have a remembrance of how they could go to the emergency department to access the entire system, and that before COVID, we really tried to help facilitate that with social workers and care management and taking x-rays that didn't need to be taken. But now we're at the point where we can't do everything for everyone. We have shifted in terms of the mindset from disaster management standpoint, where now we have to do the most amount of good for the most amount of people, and really have to stick to our guns in terms of scope of practice, that the emergency department is for, do you really think you're dying right now? And that acknowledging that there is different levels of understanding of what dying right now looks like. But if you do come because you think you're dying and the staff says, like, we've checked you out and you're not dying, is that there has to be a level of trust that I'm not saying that you're not uncomfortable and that it's not important. It's just not an emergency and we can't deal with it in this department. And that we don't even have the social worker and the staff to be able to say, oh, here's what you should do next. And that's the part that's kind of like really putting the holes in terms of our overall infrastructure and our overall net, that I don't think is like, I don't think that we can't even, unless you're in it, it's hard to even begin to understand how that impacts all the little things. And then the pressure that puts on the staff that's there in knowing that you're used to being able to do a code for like 2 hours on one person. And now it's more like, oh, that didn't work, got to move on. We don't have an event to be, trying on this. And we need the nurses in the other rooms to be able to manage the other people. So it's really like, it's a very complicated, nuanced thing, but to say that it's strained doesn't even begin to, like, that's again trying to use a hashtag to explain
what's going on.
Experience.
So Dr. Phillips, give us a kind of, from emergency room to from where your practice is, kind of give us a comparison. What's going on your end?
I think, what Dr. Taylor just said. I can tell people they can't come in. They can't do that in the emergency room. And I think what she just alluded to is that we have a familiarity of how we used to and preferred to engage the medical system. And this pandemic has changed it. Now, in my space, one of the things that we're doing is diversifying the options of what you would say, I want to see the doctor. So another thing that's emerging is we're trying to do things remotely, meaning telehealth. In addition to that, we're trying to set up situations where people can drive up and be tested. So we're trying to, as Brother Gardner has always said, we got to meet people where they're at. We're trying to adjust how we provide care. Another thing that I personally am doing is just trying to engage everyone on their understanding of where we are with this pandemic. But whether you get vaccinated or not, again, I'm still finding a lot of people not being aware of all the facts as we tease it out. As Dr. Taylor just mentioned a few minutes ago, there is a lot of fear. And with that fear, you might have people that are the hard folk that are not used to expressing that type of vulnerability, especially in an intellectual space, such as, do I understand COVID or not? And they don't. And, I'm just trying to help improve their understanding so that they can make better decisions, because as I said earlier, we've got to have a layered approach to addressing how we keep ourselves and our households safe.
So one of the things that obviously we can't forget about, we'll never forget about, is our kids, our youth. So Dr. Boykin, we hear what's going on in the emergency room. We hear what's going on in the primary care. So talk to us about from the pediatric side. What are the things we need to be worried about? Is Omicron, impacting kids worse than adults? What do we need to know about as it relates to our youth?
Well, thank you for that question, Brother DR. That is a very, very important question, because the fact is that, as with the last variant, a Delta, children don't get as ill from Omicron. But the fact that they are getting more, the transmission is higher, they're going into the hospitals a lot more for that particular reason. So, and as within the pediatric case, you got to decide what is a cold, what is flu, and what is COVID. And that's very difficult to do sometimes in children. And the one thing that we can't forget is that the children are the most impressionable people in this planet. So they are very afraid right now. They see all the stuff on the news. They hear about death and dying. So we have to be very careful about how we present information to our children. You know, if you are a parent, just remember they're going to watch you and they're going to emulate what you do. So if you show fear, they're going to show fear. If you show masking the correct way, they're going to not be afraid of wearing their mask. So you have to take that initiative to protect your children. In terms of your children going to school where there might be cases of COVID going out there, you got to decide for yourself what you want to do for your children. I can tell you this, as we all have said on numerous times, it's not a matter of if you're going to get Omicron, it's a matter of when you're going to get Omicron. Everybody's going to get it. So I would say to you, for children going to school, protect them as you would have your children be protected. And it's not just Omicron. We're in the RSV season for our younger children. We're in the flu season. We've already had a death in the pediatric population of flu already right now. So we got to be mindful of those facts. What are you going to do to protect your children when they go out into the schools, into the supermarket, and things like that? Children are afraid. Don't forget to have your children do their routine care, because that's one of the ways that we can protect them against other illnesses. You know, I would recommend highly, and again, it's your choice, but I would recommend highly that children get a flu shot, because children are probably more vulnerable to the effects of having flu than some of the older people out there, young adults out there. So to that end, children are being affected by Omicron by the sheer numbers. And so those sheer numbers are going up and hospitalizations are going up. And once they get in there, they may be exposed to other things, or if they go in there and they don't have COVID, they're probably going to get, as I said in the beginning, 30 children in the hospital right now didn't even have to go in for COVID, but they were found to have COVID when they got there. So be mindful that the children are very, very afraid. Protect your children from all the media out there. Sit down and talk to them on their level. Don't use grown-up words with them. Talk to them on a level that they can understand that this is something that we're going through. We have ways to deal with it, and it's not the end of the world. So with that, I yield back.
Dr. Guyton, I want to come to you next, but before we go to you, Dr. Guyton, to any of the doctors, just looking at the question we just got, it appears, and again, I'm not a doctor, but it appears that they're probably potentially referencing a booster. The question is, after 2 Johnson & Johnsons, do I need any more vaccinations? So any doctors want to address that question?
Well, I'll take a stab at it. You're reportedly, as we see now, if you have 2 Johnson & Johnson vaccines that you're supposed, as long as they were done within 2 months of each other, you're considered vaccinated. If it's any time further than that, you might want to consider another. If you haven't had your second Johnson & Johnson vaccine, it's been more than 2 months, you might want to consider one of the other mRNA vaccines, such as Pfizer or Moderna. But if you had to and they're 2 months apart, you consider fully vaccinated at this particular point.
Let me elaborate on that. Just to give you an example of how important that third vaccination is. Some numbers were posted, and we were working with the NIH and as well as CDC, that with 2 vaccines, you were like 57% protected from hospitalizations and sickness, hospitalization and serious infection. With that third, it went up to over 80. That third vaccination makes a difference. And now, as we look at the research, Pfizer's already doing research on a Omicron-based vaccine for COVID. Let's not forget flu. Flu is the same way. Every year, you're going to get a different variant. And flu is down around the low 60s in protecting you. So every year, why you have a new vaccine? Because they're looking at a new variant. They're doing the research. And what we have to do now is get into that rhythm of understanding that this may be around. It may become endemic. But we must first get through and understand that the unvaccinated have to understand the mitigation factors that are ongoing. They have to follow the rules. They have to wear their mask. But if they don't, it is up to you to protect your family. Being vaccinated is the safest way to prevent hospitalization and death, bottom line, from COVID-19. Omicron, Delta, whatever variant you're looking at. Let's start there. Now, the new oral medications that are being released, they are only being released and primarily going to be used for the unvaccinated and the vaccinated that are not in a complete series, 2 or 3, and the immunocompromised vaccinated. If you don't fall within that line and those groups, you will not, or you will 90% of the time, you won't even get to the oral medication. So remember, the unvaccinated, I'm talking to, in our community, I'm talking to 87% of you, 80 to 90% of you in the Black community are not vaccinated. Understand, vaccine will protect you from hospitalization and death. Bottom line. You talk about civil liberties, you talk about choices. If you got kids, those are your choices you need to make. That's what you need to understand. Your kids are more important than your civil liberties when it comes to being a parent. As Dr. Boykin has said, kids follow you, kids listen to you. So if you're getting vaccinated, guess what your kid is going to do? I can tell you right now, my 11-year-old just got over COVID. Before she was able to get the vaccine at 11, she was begging me, Daddy, how can I get a vaccine? Why? Because Daddy got it early on. She knew Daddy and Mommy was fine. She wanted to get vaccinated. I just lived through one of the worst weeks of my life. My mother and my baby had the COVID. My mother's 71 years old, diabetes, asthma. Not one day did she have a down day, a sniffle. She was outside in the yard doing her flowers and didn't know it. Why? She has 3 shots. She has the vaccine. I said to her, Mom, remember how God saved your life, but that vaccine, it helped. It helped. You're here because of that vaccine, Mom. Remember that. I'll stop there, bro.
Dr. Phillips, what's your message to people either vaccinated or unvaccinated as it relates to public gatherings? You know how we are. And I think the bruhs need to hear what you normally say as it relates to it's not over. Dr. Phillips, take it away.
Well, I'm actually going to give a testimony. I actually went on a road trip last weekend, and the group of brothers that I decided to be around, we have been in similar sort of mindsets when it comes to our safety and prevention. All of us were vaccinated. I also feel that if you have an event, maybe a couple days before, you might want to start to reduce your risky or activities that may expose you, which is what I did. Another thing that may be helpful in those circumstances, if you have access to it, because I do recognize that everyone doesn't have access to rapid tests, you can take a rapid test as long as you're asymptomatic, just to confirm as best you can. You can't be 100%, but confirm. So I took my rapid test, traveled down. The brothers I was with, we all, like I said, were of the same mindset as far as all of us being vaccinated. And again, when I came back, concerned about hopefully not bringing anything back home, took my test when I came back. I've been asymptomatic, so now I feel a little more confident. Now, I'm going to put another thing out there for our football-loving folk. The Super Bowl is in 2 weeks. So as Dr. Guyton just said, if you know what you're going to do, that booster makes a big difference in your protection. So if you haven't gotten it, which I feel there's a lot of people that aren't aware of their eligibility. So again, back to my statement earlier, as COVID ambassadors, as Dr. Taylor challenged all of us to be, we have to make sure that people understand things like when it's time to get my booster shot, because we all know we may spend time with folk come to Super Bowl, especially since it looks like we might have a good game. We want to probably optimize our safety. And last but not least, continue to stay on top of your wellness. Go for that walk. Get up. As Dr. Taylor said, take those deep breaths. Also, do the activities that help preserve your mental health. I needed that road trip. I needed it because I felt like I might be calling y'all like, damn, I didn't mean to do that to that patient. And I didn't want to put myself in that circumstance. And as again, we here talking about how this thing is impacting all of us, but we've got to be intentional about minimizing our risk as we approach COVID.
So Dr. Taylor, talk to us. We're talking about that difference between people that are vaccinated, people that are unvaccinated, people that visit the emergency room. Is there a different expectation that one should have if they are vaccinated versus them not being vaccinated? Just make sure you come off mute so we can hear all the wonderful things you're gonna tell us.
Thank you. I'm sorry about that. So I want to take, if you guys will let me, I want to take it just a little bit higher to like not get into the nitty, pull back a bit from the nitty gritty of the vaccination and really look at it more in terms of the broader principle of managing your risks. And because that's what everybody's talking about, is how you're managing your risks. And I think that one of the things that sort of an advantage that I get in working in the emergency department is that I talk to like literally all walks of life. And one of the things that keeps coming up, particularly amongst far left people who are what I call my nuts and berries friends, and then the far right people who are the Blue Lives Matter folk, that they both are not getting vaccinated for different reasons, and that in the emergency department, I don't really, while I can make recommendations, I'm also not trying to judge you on why you have or have not gotten vaccinated. Like, I'm taking care of you no matter what. But part of my responsibility is to educate you about what your risks are and how you can manage that. And so the vaccine absolutely decreases your risk. Like, it's like we can't get around that. But the other part of it is that we can't get around that the concern people have is that we don't know the long-term effects, and they know someone that, okay, I understand that, like, you're right, we don't know the long-term effects, but we're not acknowledging that we don't know the longer-term effects. And so then it feels like we're hiding something from them. It's like, no, we can't know the long-term effects. It's not been out long enough. It's not that we're trying to hide it from you. It's just we don't have it yet. But so far, it looks extremely promising, as opposed to saying, like, oh, it's great, take it. And then they're like, nah, you told me to drink the water in Flint too. Look where we're at with that. And so, you know, the number of times you hear about the Tuskegee experiment, like we can't get away from the fact that there is a reason why people are not taking the vaccine. And so if we can move past that and still encourage people to say, yes, we do have faith in it, but there are other things that we can do that will also help us manage our risks. And one of the things that we can do is that we can decrease our BMI. And as small as that seems, like, people are like, oh my God, everyone's talking about obesity. But the truth is that that's who I intubate. Like, that's people with a BMI over 30, it's not even about a judgment or anything. It's the truth is that that's who gets hospitalized. Like, that's who gets, and that a lot of the other people who are coming, it's not that I believe that you don't feel well. I believe that you're suffering, but you don't meet your risk is not high enough for you to get admitted to the hospital. So now you've sat in the emergency department for 18 hours to find out that, like, yep, you're sick, but not sick enough for us to even test you here, because we're only testing people who are going in the hospital. And so it sets up this situation where the emergency department is trying to help people manage when their risks become reality. But people don't even recognize that it's not about your behavior, it's about your recklessness. So to that end, that for my story, in that I had to make the choice of where we've been talking about modeling for your kids, and you've been talking about your mental health and doing the things that can support your mental health, that I had to make a choice that as a role model and a disaster manager and someone who is experiencing the crunch of human resource shortages in the emergency medical system in particular. My best friend, road dog, 30 years deep, turned 50 on Martin Luther King Day, and I had to not go to Miami. I chose to not go to Miami for the, dopest party that, they all had so much fun, so great, but I'm like, I can't show up in an emergency department when they're diverting ambulances and be like, oh man, who knew? I'm so sorry, you sure you can't take care of me right now? Like, I just can't ask for professional courtesy when I wasn't even courteous enough not to add strain to your system. And that if I get sick, then that means that I've just affected the entire, I've affected the emergency medical care in a county, because I work at a county hospital in in multiple different places. And so because of that, my risk and the impact that it has if I get it is different than other people's risk. And I recognize that. So I wasn't upset that all the other girls got to go, the other ladies got to go, because if they get sick, they're not going to take out an entire emergency department. Right. And so it's sort of the responsibility that comes with, agreeing to stand in the gap for folks. And so the frustration, I think, that a lot of healthcare, emergency medical care in particular, are having is that it feels as though that sacrificing that, taking those risks also, where the nurses in the emergency department are exposing themselves for hours and hours and hours to COVID. And that they're taking their lives into their hands to be able to take care of people, to then have people spit on them and like slap them and like be rude and treat them like they're airline flight attendants and stuff. It's kind of like, word, is that what we're doing right now? Oh, okay. Like, then you really want to know why you didn't get a verbal hug? Like, come on. Like, that's not how that works, you know? So I don't know if I got off on a tangent there. I'm sorry. I don't know if I answered your question, but
you're doing what we need. You know, people need to hear that. You know, that real.
And again, not judging, but again, to Dr. Phillips' point was that his your mental health is also unbelievably important. And if your mental health is going to be that if I could get a hug from my grandmother, that would be more to me than all the rest of this, then I'm going to do what's necessary so that I can go get that hug from my grandmother because it's valuable. Like, sometimes the hardest choice to make is not to choose what you want to do, but to choose not to do what you want to do so that you can do what you want to do. You know what I mean? And I don't think that
you drop some knowledge right there, 96. You drop some knowledge right there. 91. Let's talk about some alternatives, right? So people think, or people are being told that maybe there's some alternate medications that they can go and get and possibly help. Can you talk to us a little bit about whether it's information or misinformation as it relates to what's available in the pharmacies?
So let's be clear. Ivermectin does not treat COVID. Let's be upfront about it. It is a dewormer. Veterinarians are running out of it. Horses are having worm problems because humans are deciding that, hey, we want to take it. It doesn't treat it. The oral treatment now, as I stated, has been released by FDA for use. Is Paxlovid. That's the oral treatment right now. We used to be able to use monoclonal antibodies, but because Omicron now is the pervasive variant at 80 to 90%, they're now saying don't use monoclonal antibodies for the Omicron variant of COVID. Now, remember, in some of our states, they were pushing this monoclonal antibody more than we're pushing vaccines. And those states had one of the largest numbers of populations in the United States, Texas and Florida. Now, we have to now look at what are they going to do? That's been taken off the market for them. So looking at that, we must understand, as I told my mother, prevention is a big key. Ensuring your immune system is strong, making sure you have your vitamin C's, your zincs, your vitamin D's. They are not going to cure and treat COVID, but they enhance your ability to recover in a timely manner. And as I told her, some of the research that we found is that vitamin D is a factor that can influence whether you, or if you're unvaccinated, whether you live or die. And we knew that early on. So I had her taking vitamin D. I had her taking zinc. I had her taking vitamin C. And I had her step outside and just get fresh air, relax, because the mental aspect of it, because she started having anxiety. And anxiety does what? It raises your blood pressure. 71 years old, that is another risk factor. So it is a total dynamic to the body. And there's no magic pill. Ivermectin is not the magic pill. Let me clear that up right now.
There it is. Wonzie, go ahead, chime in, Wonzie. What you got for us from what you've heard tonight? What you've heard and what you want to just make sure you come off mute so we can hear you, Wonzie.
Brother Info, I'm like you tonight, watching all these four doctors talk about things where we are. And what I really find amazing is to hear Dr. Taylor discuss her personal sacrifice that she does on a daily basis so that others might continue to live and function. And I think we sometimes fail to forget that these doctors on this call are on the front lines, them and their colleagues are fighting an invisible war, and it's taking a toll on them. As Dr. Taylor was talking, Dr. Phillips was talking earlier, is the fact that over 820,000 Americans have died. And because they haven't been shot, because they haven't been blown up, we've become numb to the thing. But the hospitals today are our battlefields, our triage centers. And these professionals go in and they go out, and we expect them to live normal lives and go back on. And I'm just reminded that PTSD is lurking around the corner for a lot of these. This medical supply chain is drying up. We have doctors that probably don't want to practice anymore because they're not getting the respect that they're due after all the things, the sacrifice they're making. And just imagine if we had a visible enemy attacking us, how we'd all rally around the flag and help each other out. But because we can't see this enemy, because we have differing views on how we should take it, we don't unite behind our medical core, what they're trying to do. And I remember a time when we were all citizens of this country and my rights ended where your rights began. I remember a time when we all thought about our fellow being, I'm sitting here in awe and amazement as I listen to my four brothers and sisters talk about their profession and what they're trying to do, yet they're sped upon, they're lied about, they're not taken seriously. And how many more of us have to die? How many more of us have to suffer? How many more of us have to lose loved ones before we take this serious? And I was just sitting here thinking about Dr. Taylor. She said she didn't go to Miami to be with one of her good road buddies for 30 years and couldn't celebrate. And we ask ourselves to put on a mask, just go to Walmart or to the store. And she has to make sacrifices because she just said something I'm not sure everyone really heard. She said if she gets sick, she takes out a whole county. If she gets sick, a medical unit might close down. If she gets sick, somebody else might die because she can't service them. Now, we flip that around. How many of us can say if we get sick, something like that's going to happen? So I just like to put a plug in right now for our professional colleagues and say, it's time we start listening. And for you all beforehand, she schooled me beforehand because I was saying everybody should have a vaccine. And she broke it down. I'd like to ask her questions. She could just explain that other point of view, because everyone that doesn't get vaccinated is not crazy. They're not anti-vaxxers, but they have a history of being afraid of doctors and being afraid of medical science. So Dr. Taylor, if you could talk about that again, I want people to hear what I heard earlier. And that's why I'm trying to be quiet so I can learn more as you talk. Thank you.
Just make sure you come off mute so we can hear all your. There you go.
You know what? I just want to. I'm the worst person for this because, well, everybody, like, I have been working from home, so I don't know how to do all the Zoom like little things. So I don't know how to. So, anyways, forgive me for like messing up the mic and the reception and such.
You're all good. You're all good.
I think that what brother was talking about was that. I was telling him how just a couple of months ago was the first time, even though I've been working for 20 years now in emergency departments in between Washington State, New York City, Georgia, Illinois, like all over the place. Like I've literally taken care of probably 100,000 patients easily in my career so far. And it was only within the last 2 months in Augusta, Georgia, where I really understood and appreciated how like the fear and the anxiety for certain populations to interact with the institution and the industry of medicine, and that the distrust is so deep and so like written into our souls and like our ancestral experience of it that they can't even help themselves. And that when I used to think that these patients were being stubborn and like, why would you come here? If you don't believe I'm going to help you, then why the hell are you here? You know what I mean? Like, it's frustrating because you're like, if you think I'm going to kill you, why are you here? But then you realize like you're here because you have nowhere else to go. Like, this is the only place you could go. But just because I'm here doesn't mean I'm not totally freaked out and scared. And that the fear was to see people when they find out that they get the diagnosis, they give you this guttural like cry, like no, like they like it's the worst thing that could have ever happened was that you're going to try to hospitalize me. And then with that guttural response, how can you then tell these people that they're wrong for no, trust me, it's good, don't worry about it. And then the first thing they say is like, yeah, you told me that the water in Flint was good and I drank that. You told me that the Tuskegee experiment was good and I drank that. You told me that, Cheese Whiz was was really cheese and I ate that. And here we are, not really trusting you for anything. And we make no effort to, like, there really is a feeling that you make no effort to come into my community, to have this conversation with me, to really get me well, because that's what's good for me. But then when I become a hazard to your system and your infrastructure, now you want to show up with needles and face masks and demand that I'm compliant. Like, who are you? like we ain't cool like that. Like, you know what I mean? And so I think that it would be useful for all of us if we didn't make each other wrong for it and could respect that, like, genuinely, I am my brother's keeper. So even if you don't understand all the calculus and the pre-test probability, the post-test probability, and why I'm making these choices that I'm making, that I respect that you're really trying to do what's best for you, but not at the risk of what's best for me. And that doesn't come across. Like, there's really a loss of humanity because people are just trying to survive. And there's just, again, so much distrust. And that is, like, I think part of what's disheartening for the healthcare staff, because in order to be able to survive the PTSD that you're describing and to be able to lick your wounds and keep it moving, is that while the healthcare staff stays competent, that the compassion starts to erode. And so you're getting the science of medicine, but not the art of healing. And that misses, that's like a missed opportunity, you know, and that's frustrating. And that is, like, that's the weight that people you can't articulate in, you can't, there's no hashtag for that.
Yeah. So we are at that point every month where we get to, unfortunately, it's time for us to prepare to say goodbye until the next time. So what we're going to do is we're going to do our 1 minute closing statements. What is something that you want everyone to take away from today's webinar? So we're going to start with ladies first. Dr. Taylor, if you give us your 60 seconds or less, 1 minute closing statement. Thank you so much for joining us tonight. We definitely appreciate you. I know the ladies of Delta Sigma Theta, Sorority Incorporated, I know they are proud. You are doing them proud, but most importantly, you are doing your entire community. You're doing all of us proud as well. Thank you so much for all that you're doing in the emergency room. So Dr. Taylor, your 1 minute closing statement, please.
First of all, brothers, thank you so much for, like, inviting me to have a conversation with you. I really, like, I genuinely appreciate it. It was actually kind of cathartic, so thank you for that. I think that my one request would be that if everybody could recognize that if everyone could do what could only be done by them, that it would actually expand our access to healthcare. And that the thing that I think is frustrating right now and is, like, hampering us is that people are showing up and they're expecting to be saved. And honestly, we don't save you. Like, I support you, and the saving happens between you and your God and whatever your circumstances are. So whatever you can do to help, that would help all of us. And so remember that it's a safety net, not a trampoline.
Thank you so much, Dr. Taylor. 78, Dr. Boykin, 60 seconds or less.
Wow, what a tough act to follow. What can I say? What can I say? I think the underlying theme here is everybody ought to have a plan of what they're going to do. What you're going to do, what you're going to do to protect yourself and protect yourself from others that don't want to protect themselves from us. And the last thing I say to you, remember, our children are our future. We got to teach them and we got to protect them. So with that, be safe out there and do what you need to do.
Thank you so much, Dr. Boykin. 88, Dr. Jedan Phillips.
All right. Well, again, deepest condolences to my sisters of Delta Sigma Theta. Dr. Taylor, incredible, incredible. Appreciate what you and all of the other ER staff, and I'm going to spend my time just bigging up healthcare professionals, because it's not easy for the people that answer the phone, to the people that clean up the rooms, to the people that set up the schedules, to the nurses that take you in the room, to the people that answer the phones in the phone center, to the doctors that do it. I appreciate what each and every one of you do, and I'm sacrificed with you to help us get through this. And be patient with us. Be respectful of us. Show us a little love, a little bottle of water, good morning, a please, a thank you. All of that stuff matters because folk is tired. So with that, this is still here. We could still do the work that we can. We can do what only us can do. As Dr. Taylor just said, let's do that. Thank you.
Dr. Phillips, thank you so much, man. Let's go to 90, Brother Wonzie Gardner. You have the floor, good brother. 60 seconds or less.
Brother Mfofo, thank you very much. I am further amazed every time I get on this webinar with our esteemed guest, Dr. Taylor. You blew me away today. You gave a lot of points you want to think about. And my message is just resilience to everyone and caring for your neighbor, yourself. And as you go through your week this month, thank those unsung heroes that you see every day that are on those front lines trying to take care of us. be it in the hospital, that bus driver, that person that's serving that food, the person's picking the garbage, whatever they're doing. There are a lot of people out there that cannot go inside and cannot hunker down because their job is outside. So I just want to take this time to thank those people. And Dr. Taylor, you're a rock star, and thank you so very much for what you've done tonight. Thank you.
Thank you so much, brother Wonzie Gardner. And the last horseman, certainly not least, the pharmacist, Dr. Cedric Guyton, 91. Take us home.
Brother Pofo, I'm just happy to be here with such a great, esteemed team. My final word is remember those that are important to you. If you don't do it for yourself, do it for them. Protect your families. Understand the compassion that we once had is what's going to get us through this entire pandemic. Understand that we still have the mental health aspects that are still impacting our community. So always reach out, touch your family. How are you doing? Are you okay? The fear is real. The anxiety is real. Lastly, everyone that can hear my voice, please make sure you get your free mask and free tests that are being given out in your community. Yes, they are free. They are a part of the mitigation strategy to stop the pervasive Omicron variant. Have a good day. Thank you. Take care of yourselves. And please, if you can, get one person vaccinated.
Thank you so much, Dr. Guyton. As always, to our friends, our family that continue to join us on a monthly basis, I thank you so much on behalf of all of the brothers of the 2nd District of Omega Psi Phi Fraternity Incorporated. We thank you. Again, to our sisters of Delta Sigma Theta Sorority Incorporated, we continue to mourn with you. We are here for you. Always know that your brothers of Omega Psi Phi are here. And as I always say, please take the time out of your schedule. Please take the time out of your day to make sure, if possible, you donate blood. It's important. We're at a point now where the blood supply is very low. So please make time to go and get vaccinated, and also make time and make sure that you give blood. To our sound engineers, our producers, Brother Piercy, thank you so much for all that you do. Brother Ed Hill in the background, Brother Tim Worley in the background, making sure that everybody's able to see this across the world. We thank you so much. Continue to stay safe. Continue to stay well. Brother Kelvin Ampofo, the 2nd District Representative of Omega Psi Phi Fraternity Incorporated. God bless.